Hey transformative leaders and trauma survivors, it's Ophelia of thehappymedium.com. In the last video we talked about trauma-related OCD and the steps that a person can take to heal. Today I'm discussing 3 effective treatments for trauma-related OCD. Trauma recovery tips, tools, and strategies. Be sure to subscribe by hitting that subscribe button and click that notification bell so that you'll never miss a video when I upload new content every Wednesday. Welcome back, everybody. If you are new here, I am a licensed professional counselor and a certified clinical trauma professional, helping individuals and organizations resolve the effects of trauma and build resilience. So, effective treatment. How do you know that a treatment for trauma-related OCD works? So here's the thing about trauma-related OCD treatment. Is when a therapist and a client work together, they're working to help the client reinterpret the misinterpreted thoughts that drive the compulsory behavior. So what you should see is a reduction in the obsessional thoughts as well as the compulsory behavior as the client is able to integrate the new thoughts and the obsessional thoughts into a past-oriented mindset. So that means that the obsessional thoughts are not coming forward to hijack what is in the present for them, but you're integrating it in a way where they know, okay, this is in the past, this happened, but it's not continuing to happen. And so you break that habit based on reinterpreting the thoughts, because if they're no longer thinking along the terms of maladaptiveness, then that's going to drive the behaviors way down or maybe eliminate them altogether. Okay, so the first effective treatment is exposure and response prevention. Now this is where the therapist actually exposes the client to an anxiety-provoking stimuli. And instead of the client, responding in the typical compulsory ritualistic way, they are asked to engage in a self-soothing or calming behavior instead. So, say for example, the person came in and they are struggling with anxiety and compulsive behavior, obsessional thoughts, over having almost lost their life during a medical procedure. So the therapist is, after ensuring that the person is able to engage in some self-regulatory techniques and soothing and calming techniques, she's going to then implement, he or she, doesn't have to be a she, I'm saying she because I'm obviously thinking about myself, but going to expose the client to sort of an in vivo type of exposure. So what that means is the therapist is going to guide the client through the situation. So say for instance you're laying here in the bed and the nurse is bringing you the dose of medicine and she's ready to give it to you. Whether she gives it to you in a vial or you have to take it with, orally. And so think about, you're in that situation here, I'm giving you the pills. Now I'm going to ask you to go ahead and take them because we need to go ahead and run some more tests, so we need you to take those right now. And so what are you going to do? And the client starts to say, okay, well, let me count the pills first. I got to count and make sure. And then the therapist is going to gently say, okay, so instead of counting, we're going to have to ensure that we have asked the nurse if this is the right dose. There's nothing wrong with that. The nurse is going to double check and ensure, and once that happens, then go ahead and take the medication. Before you do that, you can wrap yourself in a blanket and you can rock a couple of times to calm yourself down. You can clench your fists real tight and you can release them. Maybe you just need to smell an essential oil or a calming type of smell to get your body relaxed. Whatever would help. So instead of you digging in your purse or to take out a handkerchief and wipe yourself here, wipe yourself there, or count them at 1, 2, 3, 4, 5. I need to make sure 1, 2, 3, 4, 5. I need to do this 5 times before I take the medicine. Instead of engaging in that, you're going to do something that calms and soothes you in a way that's appropriate. So the next two treatments are cognitive behavioral therapy and EMDR. Now I'm lumping these together because these are the two that I'm most familiar with and that I use in my practice primarily. So I'll talk about these together because I use this together, especially if I'm working with a person with trauma and they have specific issues, problems with obsessive compulsive symptoms or the actual disorder. So CBT is focused on helping the person to assign new meaning or reinterpreting the thoughts that they have by assigning alternative meaning to those thoughts. So it's helping them to come up with evidence of the veracity of that threat. So what is true? How is it true that this is going to happen again for you? And so we have the person go and gather the evidence that this is going to happen. And so sometimes they may try to come back and say, well, the evidence is that it's already happened, so I know it can happen. And the key to understanding that response is that it happened in the past. So you can tell if they say that the past is coming to hijack the present, is coming to hijack what they can do now, what can be different now. And so basically you can challenge them and say, okay, we know that happened in the past, and we know that this is the response to it and it's very strong and you remember that, but what else could be true? So we know that that's one thing that could be true, but what else could be true? And you help the person to work through other things that could possibly be true. Maybe the nurse made a mistake, and this is not the same nurse. These kinds of things, and have that person to come up with alternative meaning. And once they're able to do that, you can come sort of behind that. But before you come up behind that with EMDR, then you help them to start. So if this is true, if the nurse made a mistake, and if this time the nurse is able to give you the correct dosage and nothing happens, then what can you do in response to that? And have them come up with a possible response, a possible behavior. So now they realize that they've been reinterpreted that misinterpreted thought. They've reframed it into maybe it was a mistake. Maybe the nurse, this is not the same nurse. Or hopefully they don't say the nurse didn't know what she was doing. Maybe she didn't. But maybe they can say in response to that, I can just relax and take a deep breath. So that would be a behavioral response. Or I can tell the story. I can tell it without becoming overwhelmed. So they may not be able to do that now, but they are aware that they can tell that story, that this happened and I had this response, but here are the details. The nurse made a mistake. She gave the wrong dose. Who knows? Maybe it was the wrong medicine. Now this is the right medicine this time. And so that can be the response. Then you can come up behind that with EMDR and strengthen that through reprocessing, installing the new positive cognitions. So we know that how they felt about themselves, the way that they would like to feel. And so we're going to install that new way of thinking, those new cognitions, those new reinterpreted thoughts, that alternative meaning of what can be. And once we do that, we're going to strengthen that with the bilateral stimulations, that rhythmic side-to-side pattern of the eyes moving back and forth, and that is to help to strengthen the emotional memory, the positive emotional memory, to process that traumatic material, to integrate it into this past-oriented mindset. So that way the person knows that, yes, this did happen, but it's not happening now, and here's what could be. And once I take the leap and see that it is different this time, I'll be able to strengthen that notion that just because something happened in the past doesn't mean it's going to happen again. And so those are the kinds of tools that you can use with those two therapies that can help a person to reprocess those traumatic memories, and also in response to the reinterpreted thoughts, they can do different things, more adaptive behaviors as responses. So now you know 3 effective treatments for trauma-related OCD. And if you feel like you have other struggles with trauma that you would like to heal, I've created a mind-body guide to help you work through other forms of trauma through body awareness. You can download that guide by clicking the link below. If you're interested in joining a tight-knit group of healers, survivors, and trauma-informed leaders, I've created a Facebook group where I share the latest advice on how to heal the effects of trauma and build resilience. You can click the link below to join that group. All right, well, we're gonna wrap up today. Guys, make sure you check out the rest of these videos here to learn about other trauma-related disorders and how to heal them. And if you like this video, hit the like button below, share with your friends, and don't forget to comment. I love the feedback that you guys give me. It's really helping to make the videos that you're asking for and that you want to see. So keep it up. I love all of that feedback. And subscribe. Don't forget to hit that subscribe button and click that notification bell so that you'll be the first to know when I upload new videos every Wednesday. Thank you for joining me today, and I will see you in the next video. Bye.